Hello everybody, greetings of the day. Myself Payam Vora, pursuing MS Pharm in Pharmacology and Toxicology from Naipur Mohali. I am here to present upon infertility, different applications, treatments and different kinds of causes involved in infertility. When you talk about the basic services that are currently available for infertile couples, they can be either surrogation or they can be either counseling and emotional support, certain hormonal treatments, herbal and dietary supplements, diagnostic workup, and education on infertility and different causes. The given below will be the different kinds of references that I have adopted for making this presentation. When you talk about the different causes, it can be either the causes that are related to the organs. It can be related to the certain kinds of external factors like lifestyle, environment, psychology, or it could be different kinds of other miscellaneous factors. So when we talk about the ovarian factors, abnormal follicular stimulating hormone production, luteinized unruptured follicles, hypersecretion of the luteinizing hormone, the cytologic abnormalities in the oocytes, certain genetic disruptions. There are different peritoneal factors like antichlamydial antibodies production, mild endometriosis, tubular defects leading to altered macrophages and immune activity, endometrial factors like poor estrogen receptors, poor secretion of embryonic factors is very poor, abnormal integrin and adhesion molecules. Cervical factors involve altered cervical mucus, increase in the immune cell-mediated immunity, which is T cell immunity. Embryological factors like abnormal chromosomal complement, reduced in the production of blastocysts. Male factors involve acrosomal damage, sperm motility damage. Zona penetration ability is reduced because of hyaluronidase alterations. Psychological factors like mental disturbances, reduced BMI, and some of the other lifestyle changes are some of the major causes of male as well as female infertility. When you talk about causes and treatments for male infertility, so these are the different kinds of causes, which is azoospermia, oligospermia. There are surgical sterilization, impaired sperm motility. There is vasectomy, which is reversible. Then there is external injection of FSH and LH, which are hormones, follicle stimulating hormone and luteinizing hormone. So endometriosis, this is a treatment with surgery. So pregnancy rates after surgery, you can see that after stage 1, there is 45 to 75% chances of pregnancy. After stage 3, there is 60% of the chances. And after finally stage 4, there is 35 to 45% of chances. So how the treatment with surgery can help is useful in leading to pregnancy, in leading to gestation, parturition. So the target for the infertility drugs, you can see that expected growth of 5% of CAGR is seen from the year 2023 to 2030 of the different kinds of hormones like gonadotropins, aromatase inhibitors, some which is selective estrogen receptor modulators like tamoxifen, dopamine agonist, and other hormones. So you can see the market insights on fertility management. The end use outlook can be either men or women. And nowadays even the couples of the same sex can be involved, can be a part of this, like the female sex couples, same sex couples are also involved for the infertility management. And then there's the application of in vivo and in vitro. The different regions or the market key segment players are North America, Europe, Asia Pacific, Latin America, Middle East, Africa. The drug class outlook involves gonadotropins, hormonal agents, dopamine agonists, and other agents. When we look at the different market players, it involves Sanofi, Merck, Novartis, Pfizer, Bayer Pharmaceuticals, etc. These are the different list of treatment medications, the purpose, the considerations, and how much has been their success rate. So let's take few examples. When we talk about the medication, so clomiphene citrate, it is useful in stimulating ovulation. So it is useful in women ovulation disorders, and 10 to 12% of the cycles are higher. There are higher chances of multiple cycles, and there are higher chances of pregnancy. Letrozole, anastrozole. These are different kinds of estrogen receptors drug that acts by inducing ovulation, useful in women with PCOS, polycystic ovarian syndrome. And again, there are chances of 12 to 15% of the cycles. When you talk about herbs, so there are certain herbs that are very useful, that are useful in balancing hormones and improving the reproductive health, that are useful in prolactin production. Then we have dietary supplements like CoQ10, which is coenzyme quinone 10, which is an antioxidant useful in oxidative stress management, folic acid, which is vitamin B9, vitamin BD, that are having needs of individual assessment. Then we have laparoscopy, hysteroscopy, which are surgical invasive techniques that are useful, and there are chances of 50 to 44%. Then we have ART, which is assisted reproductive technologies that involve ZIFT, GIFT, which is gamete intrafallopian transfer. Then we have zygote intrafallopian transfer. Then we have ICSI, which is intracytoplasmic sperm injection, IVF, in vitro fertilization, sperm donation, IUI, intrauterine insemination. Weight management and lifestyle management can also be one of the concomitant thing that you can do for managing infertility. Then we have acupuncture, mind body practices. Then we have male fertility treatments. So again we have ART, which involves ICSI, that is intracytoplasmic sperm injection, which is a widely useful assisted reproductive technology. Then we have pre-implantation techniques, fertilization preservations of the women eggs. So nowadays the eggs are being preserved by women. And finally the surrogacy. So the different manufacturing companies that are involved for infertility drugs, you can see the different medications: clomiphene, letrozole, gonadotropins, HCG, metformin, progesterone, bromocriptine, which is dopamine agonist. Then we have other supportive therapies like low molecular weight heparins. The different purposes, that are common brand names, and like the different kinds of manufacturing companies like Sanofi, Novartis, Ferring Pharmaceuticals, Merck Serono, Bristol, Pfizer, etc. The different causes of male infertility and female infertility, you can see, are ovulation disorders, tubular abnormalities, endometriosis. The treatments here, I have described the different treatments in detail, and here are the references. You can see the different ovulation disorders. They can be treated by laparoscopy, gonadotropin therapies, clomiphene, maintaining lifestyle. Tubular abnormalities can be managed by IVF, in vitro fertilization, with or without salpinectomy. Endometriosis can be managed by IUI, which is intrauterine insemination, or there is production or the injections of FSH and LH. Ovulation inducing drugs like clomiphene, you can see the usual dose is about 50 milligrams per day for 5 days, and it is not appropriate for the patients who are suffering from liver problems, from fibroids, uteroids, and your ovarian cysts. Bromocriptine, which is the ovulation inducing agent, which is a useful in prolactin product, which reduces prolactin production and is a dopamine agonist. So here you can see that it is not supportive for the patients, and there are very less chances of pregnancy, but still it is considered to be one of the adjunctive therapy. Ovulation inducing agents, so there are different kinds of follicle stimulating hormones, HCG hormones, and they increase the chance of by 30 to 40% of the births. Then in ovulation inducing agents, we have different kinds of gonadotropins that are useful to induce the ovulation. Then for PCOS, ovarian disease, we have different, here you can see the different kinds of agents like vitamin D, cinnamon, birth control, spironolactone, reserpine, the different kinds of problems that they deal with. So ovulation, acne, hirsutism, which is excessive growth of hair, depression, weight loss, sensitivity to insulin, androgen levels. So there can be a direct management or an indirect management of fertility. So the direct management is either using hormones or surgical techniques. The indirect management techniques are using some herbs, lifestyle, dietary management, etc. The ART therapy is very useful, assisted reproductive techniques, which is GIFT, ZIFT, cryopreservation of eggs, intracytoplasmic ICSI, intracytoplasmic sperm injection, IVF with embryo transfer. So this is a procedure for IVF with embryo transfer. The egg and sperm are retrieved from the couple. They're combined in the petri dish and incubated for a few days. And if the fertilization and cleavage occurs, the embryo is then transferred to the uterus of the women. And finally, there is the achievement of the pregnancy. Similarly, in gametes, we have oocytes which are retrieved by laparoscopy. The sperm and the ovaries, oocytes, are placed in the same catheter. They are injected directly into the fallopian tube via laparoscopy. And this embryo travels to the uterus. And then there is fertilization, implantation, and finally pregnancy. So zygote ZIFT technique, this is a common technique in IVF and GIFT. The ova are placed in the petri dish with the sperm. There is fertilization, and then the zygote formation occurs, and it is injected into the fallopian tube. it travels to the uterus, and finally there is implantation. Cryopreservation, here you can see the examples of how eggs are being cryopreserved, and then some of the sperm or embryos are preserved by freezing for replacement in the subsequent cycles. ICSI, which is intracytoplasmic sperm injection. A single sperm is injected directly into the cytoplasm of the oocytes, and this will increase the chances of fertilization. So when there is specificity, highly specific cells is directly injected into the oocyte, so there is direct penetration and higher chances of fertilization, implantation, and pregnancy. Moving on, we have assisted reproductive technologies for same-sex couples. So now there is very much increase in this particular domain as well, because the same-sex couples also have a wish to get a kid, to become parents. So surrogacy, biological children, IVF are different kinds of techniques for the same-sex couples. So that's it for today's presentation. Thank you so much for giving me this opportunity to present and explore on such important and diverse topics. It was indeed a pleasure. Thank you so much for having a patient listen.